Sports injury is the only injury I've ever known where a person wants to go back and do the same thing again. And only a sports lover can understand it. If you are a sports person wondering how to prevent an injury, how to manage if an injury actually happens, what are the possible injuries which can happen to me, to know the psychology of coping with injuries, this video is for you. First thing first, let's classify these injuries in a simple sportsman's terminology. And the first one is the injury which occurs during the sport. For instance, tackle injury, a twist injury, or an impact injury where it could be a meniscus or an ACL, or even sometimes when a fracture can happen. And the second type of injury is that which happens because of playing the sports, not during the sports. That's the second type of injury. For instance, runners who run for a long distance over a long period of time end up having tendinopathy in their Achilles tendon, or an archer who is holding it for a very long time can result in an asymmetry causing scoliosis. And there are recent studies which also says that there are long-term injury impacts. For instance, in boxers, the repetitive hit on the skull causes chronic traumatic encephalopathy. So to summarize the examples, I would say the first one is the acute injury, which is the more dramatic type of injury. The second one is the chronic or subacute, which is a subtle one which comes hidden and comes after a period of time. And the third one is definitely a hidden one, and we are finding out, which is the long-term impact of injuries. We can leave the long-term impact of injuries for now. We can discuss about the acute injuries and the chronic injuries. Now let's discuss about acute injuries and the management. For acute injuries and management, the clear protocol remains the same. It is RICE protocol: rest, ice, compression, and elevation. There is no doubt about it. But the point is, how long should we rest? What should we rest? Because very commonly when they go and meet a doctor, the doctor says, okay, rest for a week, and that's it. They slouch in the sofa at the end of the day. But that's not the way you should be resting. When you rest, it is important to rest that particular part of the injured area, and try and as much possible work on the other areas to keep yourself strong. Get back to moving as soon as possible. For instance, if there is a calf injury, you still can strengthen your quadriceps, your hamstrings, and that is how you rest. And also, what is the window period for rest? How long are you going to rest? Sometimes you rest too much and you don't even get back to activity. The problem is that you might feel that the pain has gone away, but some of those fibers which are actually injured, for instance in a muscle injury, those fibers may turn into a scar tissue and never come back to a fully healed and active tissue ever. So you may not feel the pain, but you have given up on a particular living structure. So it is very, very important. I am very cautious when I say to my patients about how long and how should they rest. And the second thing is ice. It is also a very controversial subject, I know, but for acute injuries, for now, it is good to ice it. And the compression goes whenever there is a lot of swelling. Yes, go with a compression, decrease the swelling, and manage and decrease the period of impairment, and that's the aim of the acute injuries. And also, elevation depends on if it is a dependent structure like arms and your lower limbs. It is important to elevate so that the blood supply drains down. There is venous drainage going down and then decreases the inflammation. Icing depends on the injury. Is it if the injury is very minimal, if it is just a twinge, probably you might have to ice for a couple of days. But if the injury is of grade 2 or grade 3 and it is going to take 2 or 3 weeks to heal, and there's going to be constant swelling which is going to happen, and there is inflammation again and again. So until the inflammation subsides, you need to ice. Can I not apply heat? Is a very common question asked as well. Yes, if it is comfortable and soothing for you, and it can decrease the spasm, and that in turn can decrease the pain, it is useful. But in the early stages, the goal is to decrease the inflammation, reduce the inflammatory period. So icing is much better than heat. I completely understand the point that there is a lot of controversy going on. Personally, I stick on to ice still until there is classic evidence to say that ice is never better. I'll still use ice. Compression and elevation is to decrease the swelling and inflammation which happens in response to the injury over the tissue. So we want to decrease the inflammatory response and also drain the exudates away from the injured area. So that is why you use compression and elevation, and it's important to do it particularly if it is a dependent area. So if you are injured, and what is the most important thing you need to know, and the pain has been there and sustaining for a couple of days, what is important is to know the extent of tissue damage which has happened. Then we can classify whether it is a grade 1, grade 2, and how long will it take, whether physiotherapist is sufficient enough and there is a need for visiting a doctor. And if it is the other way around, if it is grade 4, then it is important for a physio to refer to a doctor and take further actions. And the doctor on the other instance, if they do an MRI to see that it is not a major injury which needs a surgical resection, they can always refer to a physio to try and structure a proper rehab. On the flip side, the chronic injuries are never dramatic like an acute injury. They come quietly, and then they slowly start to build. The tissue injuries comes over a period of months and years, or even sometimes decades, to actually show up. And that is why, and this is the point where I actually try and see a patient when they come in and see, is it an injury which has happened recently only because of the sports, or it's what this person has done to this particular part of the body because of the sport. Is it his way of walking, or is it the sport alone? So it involves a lot of understanding when it comes to chronic conditions to actually treat them. If you do not treat in the early stages, over a period of time there could be a lot of scar tissues develop over there, and the healing may take a long time. A chronic injury is something which should be prevented months before, or weeks before, or decade before, rather than actually seeing them after the injury. Prevention is the key when it comes to chronic injuries. So we will have to understand the sport, the demand of the sport, and then we will have to prepare ourselves for the sport, or be fairly fit enough to play that particular sport is the key thing which we need to ask. And second thing is, when we start to play the sports, we need to have the discipline to maintain yourself and respect the window period like off seasons, properly give the body sufficient time to recover. Optimal loading, for instance, is important. Say, for instance, when people play racket sports and then they load only one particular group of muscle, and there could be other group of muscle which can weaken, which can also slowly and subtly cause such injuries. And repetitive racket sports, or football, field sports, basketball, all these conditions, in all these cases, people are continuously loading themselves. So it is important for an athlete or sports person to understand himself, to understand the sports, and understand what measures he needs to take to cope with the demand of the sport, and also have to maintain discipline, such as warming up properly, cooling down properly. And also, it is not just a day's requirement, it is over a period of season or year when people continue to play professionally, how they respect the season, how they cope, and how they manage themselves. Smoking definitely delays healing, so avoid smoking, alcohol, and any other bad habit, for instance. In general, people ask me questions about warm-ups, like what are the things which I should be doing for warm-up. There's no specific thing to say when it comes to warm-up for these are the six or seven things which you can do, but I can say two clear things over here for warm-ups. One is dynamic stretching, and the other one is sport-specific activity. All right, so when an injury happens, let us forget about classification now. So whatever injury it is, sports injury is treated on the field or in the clinical setting. So most of the time in the clinical setting, they would be in the subacute stage, or maybe a couple of days after the injury. and or otherwise you'll be dealing with sports injuries which are chronic in nature, as I spoke earlier. So whatever the instance is and whatever the cause is, when a person comes to a sports physiotherapist with a particular problem, their primary goal is always to return back to sports. I have hardly seen people complaining about their pain. They usually are aiming, I mean, like, no matter, pain doesn't really matter at this point. So when I set a long-term goal to a particular patient, I always aim to return back to sports. That will be the primary goal, unless and otherwise that there is no chance. So when we plan to return back to sports, there are two things which we need to understand. A physio should have a good understanding of the sports by itself. So that is why a sports physiotherapist should have knowledge about common sports and the demands of the sports. Now, and having said that one, when we set up a goal, we will have to first of all understand the individual's ability and the capability. What is his actual status? What is his capability to gain strength in a short period of time? What is his ability to do a particular activity, come out of the impairment he has, based on his build, his biological ability, and his psychological ability as well. And many of the times it could be very frustrating for a sports person, and it can have a negative impact on a particular person. So they would be upset, and they even sometimes hate the particular sport which has given them that injury. So this is more of a psychological aspect of it. So having understood the individual's capability, then we need to understand the sports demand as such, like what type of a sports this person is going to play, what exactly is the demand of that particular sports, what is needed for this person. And combining these two things, then we will plan and frame a rehabilitation protocol for this person, depending also about, the futures, what exactly is his availability, and what time frame he has, what are the limitations he possesses, whether his job is not allowing him to attend a rehab regularly, or could be his family burden or his financial burden, so many things. And based on this, a sports physiotherapist will have to work with a person to understand and aim to return to sports. Now, having said that, in my experience, I can only say one thing. Whenever I work with a sports person who is injured, the patient-physio relationship usually goes off. It's more of a friend, and the best thing for a physio is that when a person returns back to sports, that's the best fee we could ever have. The nice thing about sports rehabilitation is that it is not just treating an injury and then settling it. It's actually bringing a person to a place and leaving into a point where they actually love to be. So that's the best thing about sports rehabilitation.